We're going to go over 5 exercises to do in bed after spine surgery involving a laminectomy and discectomy or microdiscectomy. My name is Dr. Eric Broadworth, and I recently had a hemilaminectomy and microdiscectomy on my back for a herniated disc at L4-5. I was having pain down the leg, and so I'm going to show you what exercises I'm doing now after surgery to help with the recovery. So these are simple ones that you can just do in bed. And so when you get into bed, you want to do the log roll technique. So we get in just like that. You can check out one of my other videos for doing the log roll technique specifically for getting in and out of bed. But the first exercise that we're going to do is simply ankle pumps. So we've got our legs out like this, and we're just going to pump our ankles up and down, just like so. And you really want to do, if you're laying in bed all day, 10 of these every hour that you're awake. What that's going to do is it just gets blood flow moving because you are at risk for blood clots, so it's going to help with preventing those, and that's why those are important. The next exercise that we're going to do is a glute set. So all you're simply going to do is you're just laying down like this, and you're going to squeeze your butt. Squeeze your butt together, hold for 5 seconds, 4, 3, 2, 1, relax. Squeeze again, 5, 4, 3, 2, 1. I recommend putting your hands on your butt so that way you can feel that contraction. And that's just going to help get those glutes turning on and off and strengthening those and getting those warmed up, because those really do help to support your spine. The next thing that you're going to do, and I recommend doing 10 reps of those, and doing, 2 to 3 rounds of those a day. Just start with 10 reps, and if that's easy, you can bump it up if you want. Next, what we're going to do is called a quad set. So with a quad set, we're just going to squeeze our quads. So you want to push your knees down into the bed, squeeze the quads, hold for 5 seconds, 4, 3, 2, 1, relax. And you're just simply squeezing the quads, and we're getting those to turn on and off, trying to strengthen those. Because if you are laying in bed all day, you're going to get weak, and we want to get those muscles to just turn on and off and get a little stronger. So those are called quad sets. Again, with all of these exercises, just starting with 5-second holds and doing sets of 10. The next exercise would be hamstring sets. So with the hamstring set, we've got our knees bent like so, and we're just going to dig our heels in like this, and you're holding for 5 seconds and then relax. So you're engaging the back of your thigh muscle here, that's your hamstring. So we're just pushing our heels into the bed, hold for 5 seconds, 4, 3, 2, 1, and relax, and doing 10 of those. The last exercise, so we did the ankle pumps, we did the glute sets, the quad sets, the hamstring sets. The last exercise that I would have you do is to simply do a pelvic tilt. So with a pelvic tilt, what you're going to do is you're just rounding your pelvis, and you want to be careful. Like when I do this, I can feel just some pressure on my back, but we're rounding our pelvis and flattening our back into the surface beneath us, in this case the bed. So you're just flattening your back into the bed. I am tilted up. Ideally you want to be flat, but you're just simply doing this, and you're just kind of rounding. It's called a posterior pelvic tilt. Hold it for 5, 4, 3, 2, 1. And what that's going to do is that's going to engage some deep abdominal muscles called your transverse abdominis to help with strengthening that, which is really important for anyone dealing with back pain and rehabilitating a back injury or surgery. So those are the 5 exercises that I would recommend that you start with to give a try. Do sets of 10 and do those 2 to 3 times a day. And always, I recommend checking with your surgeon before doing any of these exercises. Make sure you check with your surgeon first to make sure it is appropriate for your case. Thanks for watching. If you have any comments or questions, please put in the comments below.